Good afternoon, and thank you for joining us. This briefing is being aired live on YouTube. A reminder to maintain audio quality, please remain muted until it's time to ask your question. If you're on the phone and are able to do so, please use *6 to mute and unmute. And joining us for today's media briefing are Governor Tony Evers and DHS Secretary-designee Andrea Palm. Also available to answer questions are Dr. Ryan Westergaard, the Chief Medical Officer in the DHS Bureau of Communicable Diseases, and Ryan Nielsenstoon, the Chief Legal Counsel in the Office of the Governor. And we'll begin the briefing with remarks from Governor Tony Evers.
Good afternoon, and thanks for joining us again today. As we head into the new year, hope is on the horizon, folks. This week, we began distributing and administering the Pfizer COVID-19 vaccine across the state, a moment that I know so many have been hoping would come for months now. Since early on, the Department of Health Services and our administration have been working hard with our local, state, and federal partners to prepare for the safe, efficient distribution of the vaccine. And now we're putting our plan into action with 8 regional hubs across the state. As I've said all along, I believe in science, and I trust our scientists, researchers, and public health experts who are guiding our planning, preparation, and distribution. These folks have put a lot of effort into ensuring that the vaccine infrastructure and clinics are ready for the successful rollout of our Wisconsin COVID-19 vaccine program. As the state receives more vaccine over the coming weeks and months, we will continue to follow the recommendations from federal and state health experts regarding who is getting the vaccine and when, but we're starting now with our healthcare workers who are on the front lines. Those who live and work in our long-term care facilities, and of course the healthcare workers who are putting their health, safety, and hearts on the line to take care of all of us. But here's the bottom line. We are working to get the COVID-19 vaccine out to folks who need it quickly, safely, and equitably, and it's going to take all of us continuing to work together. And that means we all need to remember we are not just out of the woods quite yet. It's going to be a long process for everyone, and especially as we head into the holiday season. We are asking folks to continue doing your part to help keep our healthcare workers, our families, and our communities healthy and safe. That's why today we're excited to announce another tool to help us combat COVID-19 and prevent the spread that you'll be able to use right from your pocket. Next Wednesday, we'll be launching the Wisconsin WI Exposure Notification app. This smartphone app uses Bluetooth technology to let you know if you've been in close contact with someone who's tested positive. Android and iPhone users will see a notification on their phones to download or enable the app next Wednesday. And I strongly encourage you to do so once the app is available. The app is free and it's anonymous so that your privacy is protected even as you help us in stopping the spread. So look for more information on the launch of the app next week. But even though we have new tools to help prevent the spread, we still want people to enjoy the holidays safely. So just as we did last month, we're encouraging Wisconsinites to celebrate the holidays virtually and within their own households. Don't host parties or gatherings at your home or anywhere else with folks you don't live with. Getting tested is an important part of our efforts to box in the virus, but it isn't a pass to attend a gathering. Your test results are only a snapshot in time, and a negative test one day does not guarantee a negative test the next. So please continue to stay home whenever possible, wear masks whenever you have to go out, and practice physical distancing from anyone you don't live with. Let's head into the new year healthy and ready to take on the virus in 2021. Finally, well, there's a light at the end of the tunnel and a new year full of opportunities around the corner. This time of year can be difficult for many. Wisconsinites across our state and country have had a really stressful year personally, financially, emotionally, and it's important to remember that no matter what you're going through, you're not alone and help is available. The Department of Health Services has compiled resources for Wisconsinites to stay resilient through tough times. From assistance with paying bills and putting food on the table to mental health counseling head to dhs.wisconsin.gov/resilient to find help. Let's stay hopeful. Let's stay safe. Let's get through these upcoming months together, Wisconsin. So with that, I will now hand things over to Secretary-Designee Andrea Palm for her update. Andrea, it's all yours.
Thanks, Governor. Good afternoon, everyone, and thanks for joining us again today. We're adding 3,643 new cases today to our total, which brings us to 448,441 confirmed cases here in Wisconsin. Our 7-day average of cases is 3,192. Today, we're reporting 59 more Wisconsinites have died from COVID-19, which brings our total deaths to 4,255. As always, our thoughts are with the families and friends who have lost loved ones. This past week marks a turning point in a year that has brought many more challenges than we bargained for. To be clear, we're still in the middle of a pandemic, and we need to keep doing what we know works to stop the spread. We need to stay home, physically distance, wear a mask, and wash your hands, because we know that these public health tools make a difference when we all do them together. But the addition of a vaccine in our COVID-19 toolbox really is an important milestone. This week, Pfizer Vaccine has been arriving in Wisconsin at our 8 regional hubs across the state, each of which is outfitted with the required ultra-cold storage equipment. Our logistics, distribution, and transportation teams report that their work has gone smoothly and vaccination of healthcare workers has begun. We're hearing stories of healthcare providers being overcome with emotion as they received their vaccine. Being focused on the nuts and bolts of the logistics and distribution, I didn't really think about how much relief and excitement we'd all feel collectively as a state as vaccines started rolling out. But of course we would, and of course our healthcare workers would. They've seen so much suffering on the front lines of this pandemic. We are grateful for their tireless work and dedication, and we are thankful that the COVID vaccine is here. Pending its own emergency use authorization from the FDA, the Moderna vaccine should be available for staff and residents of long-term care facilities starting December 28th. This partnership with CDC and national pharmacy chains will provide on-site vaccinations at our skilled nursing facilities, and will provide more updates on that program and all of our vaccine distribution work on our COVID-19 vaccine webpage, which you can find by visiting dhs.wisconsin.gov/COVID-19 and click on the vaccine tab. Finally, please remember that it will be months before vaccine is widely available, so please continue to stay home, wash your hands, wear a mask, and physically distance. If you have symptoms of COVID-19 or if you've been exposed, please get tested, isolate, and quarantine. We've added another tool to our toolbox thanks to the vaccine, but we need to remain vigilant and continue using these other tools just a little while longer. Thank you.
Thank you, and we'll now take your questions. A reminder to maintain audio quality. Please keep phones on mute until it's time to ask your question. And we'll begin this afternoon with Mason Dowling from WAOW-TV in Wausau. Mason? Mason Dowling? Moving on then to Danny Maxwell from WKOW-TV in Madison. Danny?
Hi, thank you. I know the vaccine is very encouraging news to a lot of people, but we are hearing from some rural hospitals that they need more communication and assurance from DHS about where their vaccination applications are in the process and when they should be expecting vaccines. So can you give us an update on that for our rural hospitals and clinics?
Absolutely. Just for a little bit of context, there are federal requirements about registering to be a vaccinator, and we are engaged with our healthcare providers around the state in making their way through that process and being confirmed as eligible vaccinators. That process is underway, and we will continue to prioritize our hospitals across the state to make sure, considering the 1A priority of frontline healthcare workers, that those applications and that work is done as quickly as possible. I think it's important to remember that we have 49,725 doses of vaccine here in the state of Wisconsin, and we have over 400,000 frontline healthcare workers. So it will take months for us to get through all of our healthcare workers. We want that work to happen as quickly as possible, and continue with the governor's leadership to encourage the federal government to prioritize us in the distribution of vaccines so that we are able to get through our healthcare workers as quickly as possible.
Thank you, Danny. Now to Stephanie Hoff from WisPolitics. Stephanie?
Hi, and thanks for taking my call today. So with this new app, I'm wondering, did the state have to pay for it? Is it a partnership with a company? How did that come about?
I don't have the details on that, so.
So this is a Google-Apple collaboration, and there are a few states who have rolled it out. We, as you know from the press release, intend to roll it out next week and anticipate other states to follow. The app is available through the iPhone and through Google in their app stores, and I'm going to have to get back to you on the cost question, but we certainly are glad to have this additional tool and are anxious to roll it out and make it available next Wednesday to folks across Wisconsin.
Thank you, Stephanie. Now to Heather Poltrock from WSAW-TV in Wausau. Heather.
This question is for Secretary Palm. Yesterday you talked about how the vaccine data would be on DHS's website similar to the case data. And I wanted to know if you could talk in detail about what information will be there and when you expect to have that information available on the website.
Yeah. You know, as we have throughout this pandemic, we have continued to add pages and tabs and sections that relate to the various pieces of the response, you know, the alternate care facility, our lab capacity, and other, you know, the wastewater was the latest tab we added, and so we do expect to do something very similar for vaccines, so that we are able not only to provide information about the number of vaccines, but information that is more granular, as we have done in reporting cases and deaths. So that is all under development right now, and we will we intend to launch here very soon, because we do understand the interest that folks have in knowing how many vaccines and where they have gotten into arms, you know, what parts of the state they've gotten into arms. So we'll continue to work through that, and do anticipate launching that here in the next week or so.
Thank you, Heather. Now to Mitchell Schmidt from the Wisconsin State Journal. Mitchell?
Yeah, thank you everybody for the call today. I was wondering if you might have this might be a question for DHS. I was wondering if you might be able to give an update on the estimated number of doses and the arrival time for the next shipment of the Pfizer vaccine. And then I think you had mentioned the Moderna vaccine as well. Could you just run through that one more time? I thought you had mentioned a date, but it was a little unclear here on my end. Thank you.
Yeah, sure. So as we understand it from the feds, we will receive final allocation numbers each week. We understand that will likely continue to be on Fridays, and so that'll tell us what to expect the following week. As to exact arrival times for those shipments, it's not entirely clear to me that they will happen like it did this week, where, you know, two hubs on Monday, 4 on Tuesday, and the final ones on Wednesday. We continue to try to understand those details as they become available. The Moderna vaccine similarly is predicated, as was the Pfizer originally, on when it is approved, if and when it is approved, and those steps that are necessary as it relates to the Federal Advisory Committee on Immunization Practices and their guidelines, and then the CDC's acceptance of those, and then them getting the green light to start actually distributing vaccine to the states. So, we are hopeful for approval of that vaccine, and that we will receive our allocation next week, which we understand to be about 101,000 vaccines.
Thank you, Mitchell. Now to Scott Bauer from the Associated Press. Scott?
Hi. Kind of piggybacking on Mitch's question, some states have reported that they're expecting a delay in the second round of vaccine from Pfizer. Do we have any reason to believe that next week's shipment will be delayed or somewhat smaller than originally thought?
Yeah. Scott, I have not heard that we are anticipating a delay. I have heard that it's possible that our allocation for next week will be less than our initial allocation, that 49,725. I have heard that it's possible that our next allocation is less than that, but I have not heard about a delay.
Thanks, Scott. Now to Ben Krumholtz from Fox 11 in Green Bay. Ben? Fox 11?
Yep. Hi. Sorry. Thank you for the opportunity. Governor Evers, budget question for you. Over at least 11 years, different studies have found Green Bay Correctional Institution is antiquated and should be decommissioned. What do you believe is the best solution for the prison, and do you have any plans to address it in your next budget?
Yeah, we will be looking at all options. There's no question about it. But the most important thing, yes, we have to look at facilities, but we also have to look at the whole issue of criminal justice reform and the fact that many believe that we need to take a look at how many people we have in those institutions. So those things will all play together into one large discussion, whether it's time to retire a facility and frankly even more important, are we putting people in prison when it would be much better to make sure that they get the help they need instead of going to prison, whether it's drug courts, whether it's other opportunities for deferral of sentences, so that people can get control of their lives without having to go to prison. So it's a major lift. We cannot be making these decisions based on facilities alone. We also have to take a look at how we should be reforming our criminal justice system in and of itself.
Thank you, Ben. Now to Katie Anderson from WBAY-TV in Green Bay. Katie? Again, Katie Anderson. Okay, moving on then to Madeline Anderson from Fox 6 in Milwaukee. Madeline?
Hi, I have a multi-part question. So yesterday, Secretary-designee Paul mentioned that 192 shots had been recorded into the Wisconsin Immunization Registry. Do you have an update on the numbers today? And then also, why haven't more vaccines been administered over the past couple of days, since the state has already received the 50,000 Pfizer doses? And then finally, moving forward, how quickly do you think you'll be able to use all of those 50,000 doses? Thank you.
There are 3 questions in one.
It's my lucky day. So let me try to take them in turn, and I may need a reminder. So the 192 number was as of the end of the day on Tuesday. So as of end of day yesterday, the number was 1,010, and I can tell you that represents Wisconsin healthcare workers who reside in 45 counties across the state of Wisconsin. As it relates to the second part of your question, I think one thing to keep in mind about the Pfizer vaccine is that, and I certainly would welcome Dr. Westergaard to weigh in on this as well, but you know, that ultra cold storage and the handling of that vaccine makes it very fragile, and so healthcare providers, I think, are understandably being careful and making sure that they are dotting all the I's and crossing all the T's before they start taking that vaccine out of cold storage, because once it thaws, there's a very small window for its use. And what we all want more than anything is to maximize the number of doses we have and make sure they get in arms and that we don't waste any of that vaccine. And so I think some of what you're seeing is healthcare providers finishing their own planning as it relates to vaccine clinics for their workers, again, to make sure that they are maximizing and rolling out their vaccines in a way that gets the timing right as it relates to the thawing of the doses that are in their vials. But if you want to add anything to that.
I think it's exactly right. We've had some conversations with health system leaders, and it's a brand new workflow. And they've been doing dress rehearsals to make sure that they know exactly how it's going from freezer to person, and started with a small number of chairs and are increasing that day by day. So you're exactly right. There's new workflows that we want to make sure we're doing exactly right with no mistakes, and that takes some time to scale up. So I think every health system that's participating is going to have a similar learning curve, and I think it's appropriate because we want to make sure that we're doing things efficiently and with no mistakes.
Thank you, Madeline. Now to Rob Sussman from WTAQ Radio in Green Bay. Rob?
Hi, thanks for taking my question. Before the Thanksgiving holiday, there were a number of prognostications, including from many of the members of this panel, that there would be a large spike following the Thanksgiving holiday due to travel, people gathering for holiday gatherings with their families and friends. There has not really been such a spike. The numbers have gone down consistently since Thanksgiving. My question is, why do you think that the early predictions were off the mark here? Thank you.
Yeah, so I think, Ray, some of what you have seen throughout this pandemic is looking at the data, projecting out, and then as we've talked about before, doing everything we could to make it not come true. And so we worked really hard to message and to talk to people about making safe choices about their holiday celebrations. You know, while we certainly didn't want to say them and people didn't want to hear them, they were important to our work together to try to reduce the strain on hospitals, to try to reduce the daily number of cases, and ultimately get those numbers of daily deaths also going in the right direction. So, you know, the tools that we know work continue to work, and we continue to encourage Wisconsinites to use them. And as the governor's opening remarks encouraged us to do it again in the upcoming holiday season, so that that what we saw coming out of Thanksgiving, we can have a repeat of coming out of Christmas and the other end of the year holidays. I think it is also important, though, to remember that our daily numbers are still too high. We still have staffing shortages at hospitals. We still have hospitals that are strained. And so while we are going in the right direction, there is a lot of work left to do, and we need to continue to remain vigilant and do this work together.
Thank you, Rob. Now to Molly Beck from the Milwaukee Journal-Sentinel. Molly.
Hi, thanks for having this call. This question is for the governor. Governor, how are the talks going with legislative leadership on a relief bill, and do you expect that bill, if it is released, to be taken up in January at this point?
Yeah, we met earlier this week, as I recall, with both leaders, And clearly, it has become much more complex in that the Senate now has a list of things that they're interested in seeing happen, and also they're not interested, putting it mildly, they are not going to come into session, no matter what happens in December. So is it likely that it is going to, if it happens, it'll happen in January? I'd say that's probably likely, just because, I mean, we have to take a look at not only the list of ideas, but the actual language behind it from the Senate side to see what levels of agreement we can have or not have. So the good news is this, though, that we just initially looking at the Senate side, there are some that we would always have difficulty accepting, but there are some that we could, and there were several on the Assembly side that we could agree on. So there's general agreement on a number of items, but we have to look carefully at the ones that we don't have the specific language on, and see what happens after that. But we're still having conversations around that, but it's certainly been made more complex by receiving the Senate's list of items, and also if they absolutely refuse not to come in December, that kind of narrows it down to after the first of the year.
Thank you, Molly. Now to Lane Kimball from News 3 Now in Madison. Lane?
Yes, this is Naomi actually with WIC. I know December 28th is the estimate for when Moderna vaccines first started arriving at long-term care, and I know a lot of this will be handled with the federal pharmacy program, but I am curious if there's any new estimates for how long before all of the roughly 5,000 nursing homes and other long-term care facilities will have their first doses based on how the state plans to allocate the Moderna vaccine.
Yeah, so the pharmacy program, or the federal pharmacy distribution program, which is how we have chosen to participate, as have many other states, in helping our skilled nursing facilities get vaccine, requires that when we turn the program on, which, as you know, we did on Monday, that we have enough allocations to be able to bank what we need to serve those populations. And so we expect from our allocation, our Moderna allocation, that 25% of what is necessary to vaccinate, first dose vaccination at skilled nursing will roll the first week, and then it will go from there according to the program parameters. We continue to talk with the feds and with the pharmacy chains to understand how they will operationalize this, but we have indicated that those vaccines are to be set aside for our skilled nursing facilities to get this program rolling.
Thank you. And now on to Ben Kessling from the Wall Street Journal. Ben?
Hi, Governor. As far as the lockdowns and restrictions in the state go, what's the difference now in the second wave as opposed to the first wave? As far as how you're handling things, what's different with as opposed to the spring, with an understanding of what works, how it affects citizens' attitudes towards restrictions, and how much you have to calculate the politics of all this, and what kind of economic and popular backlash restrictions will trigger. Thank you.
That is. I could write a book on that instead of just answering a long question. Certainly, in my opinion, our inability to mitigate mitigate issues around this disease has been real frustrating. We had several early losses in the Supreme Court, and that really put us in a difficult position. We had a safer at home order that we implemented in April and May, and subsequent to that, our ability to mitigate is what you're seeing right here on my face, and that's a mask. And even that has been thrown out from time to time. So we've worked hard to call upon the goodwill of the people in Wisconsin to mitigate the best we can. I think as a result of that lack of mitigation, whether that's, making public gatherings smaller and other mitigation strategies, that has caused us to be in a far worse position this fall than most other states in the country. I do believe that our efforts around keeping people safe and socially distant over time we've talked about it, frankly, every week here, sitting at this table. I think it's had some impact. Wisconsinites are pretty independent folks, but they also understand that if they don't mitigate and if they don't do the right things, such as wear a mask, keep socially distanced, don't go into small spaces with a bunch of people that don't have masks on, all those things that make sense. I think that is an issue that our people of Wisconsin have responded to. But I believe, and I'll never waver from this, is that it was made much more difficult by decisions made by Republicans to challenge mitigation strategies and by their allies in the Supreme Court of Wisconsin to support those challenges to mitigation. Most other states in the country have not had that. If anything, if any other states chose or were in the same position, it's because they chose not to mitigate, and there are a few states that did that. That was not our choice. So we relied on the goodwill of people of Wisconsin, and we're slowly moving in the right direction.
Thank you, Ben. Now to Sean Kirkby from Wisconsin Health News. Sean.
Hi, thank you for holding this. I was wondering, can you talk a little bit about where contact tracing efforts are in the state? I know a few health departments were in crisis mode earlier in November, but where are we now? Are they still in crisis? Thank you.
Mm-hmm. Thanks, John. Because obviously, while vaccine is an important milestone here, we still do continue to need to do the other pieces of this response, including testing. And I would encourage folks, if you have symptoms or if you've been in contact, that you get tested. Our testing numbers are still down, and we aren't testing enough. And so I would encourage folks who need a test to get a test. And to that point, Sean, as we have seen our daily case numbers go down, we certainly are hearing from our local public health partners that they are not overwhelmed like they were in late October and into November, and our surge capacity at the state level is able on a daily basis to handle all of the referrals that we are getting from our local public health partners. So we continue to encourage local public health to use us, to let us help them if they are still having trouble getting through all of their contact tracing. This ebbs and flows with the total number of daily cases, and at the moment, our workforce seems to be well positioned to handle what work is coming in on a daily basis.
Thank you, Sean. Now to Sierra Whaley from WJFW TV in Rhinelander. Sierra. WJFW. Okay, moving on then to Eric Gunn from Wisconsin Examiner. Eric.
Hi, thank you for the opportunity to ask this question. This is, I think, for Governor Evers as well as for Secretary-designee Palm. As you probably know, there are about 4,000 UW nursing students being offered a $500 tuition refund if they take healthcare jobs and work at least 50 hours between December 1st and February 1st. Wondering what this says about our state's COVID-19 efforts if the staffing numbers in healthcare are so strained that we're having to do this to press nursing students into service to fill those gaps. Thank you very much.
And I'll just start out. I've had a chance to talk to former Governor Thompson around this issues and others, and you know, yes, it is an issue, but the fact of the matter is we're in the middle of a pandemic, and we come to the table with a public health system that was underfunded for years, whether it's at the federal or state level, and so of course we're very happy that a lot of these nursing students are taking advantage of this and already are signed up and doing good work. But it tells me as governor the importance of standing up a solid funded public health system, or pre-pandemic, post-pandemic, during pandemic, and it certainly makes it difficult to build that public health system up during a pandemic. So we need to learn that lesson, and we also need to learn that we have to find ways to make sure that we use every tool that we can to mitigate diseases once they show up.
Yeah, I mean, I would echo that. I think it is also important to know that many nursing students or other health profession students do take jobs in healthcare while they are still in school. I would say particularly to our nursing students, some of the foundational work that they do qualifies for the training that is necessary to become a CNA, and so there is some natural overlap there that makes them, for any of them that aren't already engaged in healthcare work, makes them well prepared to pitch in nursing homes and in other settings where we have seen staffing shortages. And right, we were in a shortage of CNAs before this pandemic. They are, it's a hard job. It's and as an aging population, et cetera, we've had shortages in this profession before the pandemic, and so it's become more critical as a result of the pandemic, and because of community spread and the intensity with which folks going about their daily lives were exposed and needing to quarantine and step out of the workforce, their healthcare workforce jobs, in order to not potentially bring COVID into places like hospitals and nursing homes. So we're grateful that Governor Thompson has stood up this program. We hope that some of his nursing students who aren't already engaged in healthcare work will take advantage of the tuition credit. And we are, as part of pulling every lever that we can to help mitigate staffing shortages, happy to have this additional asset in the form of our nursing students as part of the response to help mitigate staffing shortages.
Thank you, Eric. Now to Rose Schmidt from CBS 58 in Milwaukee. Rose?
Hi. Hi, thanks for taking my question. This is kind of a clarification question. So I know that the initial allocation of Pfizer doses was 50,000. And so my understanding is that, because 2 doses of this vaccine are required, that would mean that only essentially 25,000 people could be vaccinated with that first allocation. So please correct me if I'm wrong on that. And I guess I wanted to know what the timeline will be on getting the second dose for all these people, and and I guess why it's important to get both of those doses, and whether or not it's still effective if you only get one of them. Thanks.
Yep. Appreciate the question, because I think we can't say this enough, because it is this 2-dose regimen makes things confusing. But the way the feds have decided to do this, our allocation of 49,725, or the allocation of whatever week it is the first dose, and so we will be able to give first dose to 49,725 people. When they send us that allocation, they set aside the 49,725 doses that are the second dose, and will ship them to us at the appropriate time frame. So when you hear of our allocation, when you hear of those numbers, it is it represents the full 2-dose regimen that is required to get to the 95% effectiveness of the vaccine. And I'll let Dr. Westergaard talk about the science of the effectiveness.
Yeah, it's a great question. You know, the large clinical trials that were done to base the approval on, like all well-done clinical trials, are carefully designed to answer a specific question when an intervention is given in a certain way. So they tested the effectiveness of a 2-dose series separated by 3 weeks, and that was at 94-95% effectiveness. So it is possible that 1 dose offers some protection, but we don't know enough. And so our recommendation is always going to be, what does the science tell us that we can feel confident is going to offer the appropriate level of benefit? So in this case, because the clinical trials were done with 2 doses, and that's the results that we have, the recommendation is 2 doses. So everybody who gets the first dose of the Pfizer vaccine should get the second dose 3 weeks later, and that's going to be a universal recommendation. The Moderna vaccine, which is under review as we speak, is separated by 4 weeks, but it's going to be the similar kind of schedule, and people must get 2 doses to expect to get fully protected.
Thank you, Rose. Now to Jonathan Nizer from NBC 26. Jonathan?
Yes, thank you for the opportunity. Building off an earlier question that sort of got to a perceived lack of urgency of getting these doses that we have into arms, unless I'm mistaken, Pfizer says the vaccine can remain in a 40-degree Fahrenheit refrigerator for 5 days after it's taken out of that super cold storage. And right now, the Pfizer vaccine is only going to healthcare workers, but people 70 or older make up nearly 80% of the reported COVID deaths. Was there anything that precluded the state from giving nursing home residents some of these first doses?
Yeah, so we obviously within the category that ACIP recommended were healthcare workers and those working and living in skilled nursing facilities. So we have pushed our 49,725 doses to our hospitals and frontline healthcare workers, and have turned on the skilled nursing facility program that is the partnership between the feds and Walgreens and CVS. We expect that program will begin the week of December 28th. I think it's important, again, to understand that our allocation had to be large enough to have essentially in the bank enough vaccines for that population. And so with our anticipated 101,000 doses of Moderna vaccine, we were able to have, again, enough in the bank to trigger that program, and so that is what we did.
Thank you, Jonathan. Now to Denise Lockwood from Racine County Eye. Denise.
Hi, my question is with regards to all of the data that you guys have with the wastewater and the vaccines and the testing. What kinds of things are you guys learning on how this virus is behaving around the state, and how is your strategy maybe changed, not changed?
So, yeah, you're pointing to a lot of the different dimensions. That's something we've talked a lot about, is if we want to know what the epidemic is doing, we can't focus just on tests, we can't focus just on hospitalizations, we really have to look at from multiple perspectives. And the ones that you mentioned, and I think the most recent of those, the wastewater treatment data, is a sort of interesting, if preliminary, view that we can take, are all sort of telling the same story, which is that the level of disease activity remains high but has plateaued, where it was very elevated in the first half of November, really climbing higher by day by day. It was very concerning. It stopped increasing day by day, but it has plateaued at a high level, 3,000 cases per day in the past week, and our percent positivity rate is still about 10%. So that still, on average, is a high level of disease activity statewide. And the second part of your question, I think, is the important one. How does that change our strategy? And it really is not at all. We need to continue and double down on all of the things that we've been doing. At the current level of activity, the continuing use of masks and social distancing and restricting gatherings is very, very important. And we're hopeful that the other activities, like contact tracing and notifying people who've been exposed and encouraging and supporting people to be quarantined during the week to 10 days after they're exposed is going to have an even greater impact now that we have some breathing room and we're out of that really crisis mode. So the strategy stays the same, although the danger is still high.
Thank you, Denise. Now to Griselda Perez from Spectrum News. Griselda? Spectrum News? Okay, we'll move on to Taryn Powell from Milwaukee Public Radio. Taryn?
Hi, thanks for taking my call. I just wanted to know if we could get a little bit more information just about how the app with more information coming out next week, just wanted to know how the app works specifically about telling people if they've been exposed to COVID-19. Thank you.
Mm-hmm. So a couple of things about it, I think. So first off, next Wednesday, folks will receive a push notification on their phone that will ask them if they're interested in opting into the app, and will remind them that now is the time to download it and opt into the program. And we encourage folks to do that. And then as the program progresses, if you opt in and you later test positive for COVID-19, you will be, as usual, notified of your positive result, and you'll be asked, do you want to notify people who you were in close proximity to for 15 minutes that you have tested positive, so that they know that they've been exposed to a positive case of COVID-19. So I think the important thing to understand about the technology is that it is keyed off of Bluetooth and not GPS. So it is not a tracking tool. It is the way we are protecting privacy and allowing this to be anonymous. So I think those were important considerations that when we looked at technologies earlier in the outbreak, we didn't feel comfortable as it relates to privacy, and it's a very different thing with this particular application. And so there will be sort of two pieces of this. One, that initial, do you want to download the app and participate in this, and you will get that push notification next Wednesday. And then secondarily, if you test positive, that message that says, do you want to notify people that you have tested positive and who are in close proximity to you.
Thank you, Taryn. And we have time for just a couple more questions. So we'll go now to Sean Gallagher from TMJ for Milwaukee. Sean?
Yeah, thank you. So I just got off the phone with a representative from the School Sisters of Notre Dame who lost 8 nuns to the COVID virus in the last week. Second time in the year that we've lost a group of sisters to the virus. Just want to see any comment that you have on this and what the state can do to prevent something like this from happening again.
Well, the only thing I can tell you is that what I read in the paper, and certainly we mourn their loss, and we'll continue to do what we can do to make sure that people are safe in nursing homes, and whether it's these sisters or any other institution that has people at risk, it's important that they follow the protocols that we have laid out. We'll continue to monitor all nursing homes just like we have in the past, and making sure that they're following the best practices.
Thank you, Sean. And our final question today belongs to Hillary Mintz from WISN-TV in Milwaukee. Hillary?
Yeah, hi. My question is regarding the number of doses in the vials. The FDA said that
each vial contains 5 doses, except they're finding that sometimes there's extra, maybe for a 6th or 7th, and they say go ahead and give them. So my question is, what is the state's recommendation if healthcare facilities find they have extra doses? Should they give them?
Yeah, we will absolutely follow the FDA recommendations on that, but I'll let Dr. Westergaard say more.
Yeah, I think it's in the vials that get delivered need to get diluted and with sterile saline. So once the active ingredient gets diluted, you can draw out the appropriate dose, and there's enough dose for 6 syringes instead of 5. They should all have the same concentration. They should all be of the same quality, so they can be used. And I think that was the clarification from the FDA or CDC today, was that they should be safe to use, even though it's more than was initially labeled.
Thank you, Hillary, and that concludes today's briefing. If we were unable to get to your question today, please contact the DHS Communications team, and please continue to monitor the DHS COVID-19 web pages for data and guidance. Additional information can be found on the websites of the Governor, the Department of Workforce Development, the Department of Public Instruction, the Department of Children and Families, and Wisconsin Emergency Management. Be safe and have a great afternoon.